The next team that we're going to have joining us are also part of the PCOM family, and they're going to talk to us about osteopathic medicine. I have so many students that ask me questions about osteopathic medicine, and I'll be honest, before I went to work at PCOM, I wasn't really sure exactly what osteopathic medicine was, but I've enjoyed my time there immensely, and great education taking place there. And so I'm very excited to present to you our next group from PCOM that will be talking about osteopathic medical school, and we'll let them introduce themselves.
Hello, everyone. Hi, Dr. Jones.
Hello, how you doing?
All right. Hi, Dr. Penny. I am Ajua Dunum. I am an associate. I always say assistant, way past that point. Associate professor of neuroscience and physiology at PCOM Georgia campus. And I'm also the director of interprofessional education. It's really my favorite role. I make the students learn how to play together with other health professionals. I've been there for a good minute, since 2006.
And what's your role on the admissions committee?
Oh, yes, I am. Sorry, I am the co-chair of the admissions committee. So I don't make the decision, all the decisions by myself, but I play a good part in trying to select our students. Dr. Jones, are you on?
Yes.
Dr. Jones, yes. Dr. Graham.
Yes, I'm here. Can you guys hear me okay?
Yes.
Okay.
We hear you.
I'm Dr. Graham. I am actually a assistant professor of medicine and geriatrics at Emory, but I am a DO. I went to PCOM, Georgia. I am a class of 2011 graduate. So I'm here kind of to talk about osteopathic medicine and also represent my school, as well with Dr. A, and answer questions that you guys may have about osteopathic medicine.
Okay, so as the title page says, I'm Ajua Dunum. I'm originally from Ghana, but I've been here for so long. I think my accent is gone, but maybe not. And of course, we have Dr. Graham. So Dr. Graham, run with it.
All right, so I know that our time is short, so I'll try not to go over it too long. But so in the United States, there are 2 licensed physicians, MDs, who I'm sure you're all familiar with, which is a majority of the physician workforce. But osteopathic medicine is gaining a lot of ground with all the new schools are opening. About 1/3 of medical students in the United States are osteopathic medical students. So that means in the future, about 1/3 of physicians will also match up and be DOs. DOs and MDs work side by side. DOs can do any medical specialty, neurosurgery, orthopedic surgery, dermatology, you name it, rheumatology. We are doing every specialty. Just to talk a little bit about the differences, allopathic schools or MD schools practice allopathic medicine, which is kind of the traditional diagnosis and treatment of human disease. DO schools have this holistic view of patient care and how basically the body is interconnected through the musculoskeletal system, all things, so to speak, all working together in this kind of physiologic harmony. And so part of the philosophy is using the musculoskeletal system as a way to help treat, sometimes treat in tandem with medicines, with surgery, that OMT or osteopathic manipulation can be used to alleviate disease as well, and to bring back kind of physiologic harmony, for lack of a better term, is kind of a difference in osteopathic medicine. So you learn all of the same stuff that your MD counterparts learn in terms of pharmacology and pathophys, all that stuff you learn. Biochemistry, but in addition to that, you learn this osteopathic manipulative treatment. So you actually go to class a lot longer. Your class days tend to be longer because of this extra skill set that you gain. And just a quick little history tidbit before Dr. A takes over is Andrew still MD. There's this famous phrase of he flung the flag of osteopathy in 1874. He was an MD by training at that time and started the osteopathic profession. All right, Dr. A.
Next slide, please. I think, oh yeah. Okay, so 1 in 4 medical students attend a DO school, right? And as Dr. Graham said, the numbers with DO students, DO physicians are trying to catch up to the allopathic ones. This year, let me put it this way. Prior to this year, the residency programs were separate. As of this year, 2020, they are the same with the ACGME. So both DOs and MDs are able to match into any residency program of their choice, anywhere. There are currently 38 accredited DO schools in the US in 59 locations in 32 states. So catching up very slowly. It seems as if every time you look up, there's a DO school or DO campus or location being opened, somewhere else. Next slide. Okay, so when it comes to PCOM, it was founded in 1899, so a long time ago. And the exciting news that I got from the president today was that the very first DO physician, female physician in the country was a PCOM graduate, Dr. Meta Christie. And it's just exciting, very, very exciting. Then as a woman, I see that she opened the way, paved the way for so many other women. So at PCOM, we have 3 locations or 3 campuses. The original location is in Philadelphia. Then we have the Georgia or North Georgia or Suwanee campus, which was started in 2005, I believe, Dr. Graham? Yes, 2005. And last year in 2019, the last location, which is in South Georgia, Moultrie specifically, was opened. Next slide. Okay, so the next couple of slides basically just points to the different programs that are offered, but we're going to definitely focus on the DO program, right? So that we have a lot of programs. So if you know anyone else who's interested in any one of these programs, please tell them to, check out those programs online. Next slide. Yep, and more programs. And it keeps going on and on and on and on. Next slide. I think this is where we start. Okay, so when it comes to applying, there is the application cycle, and the application is done through ACOMAS instead of AAMC, right? And the cycle opened this year, May 5th. So typically, students go in and apply, and by June 15th, colleges start receiving applications, and then they start reviewing for interviews. So I believe our first interview here at PCOM, at least in Suwanee, as I call it North Georgia, since we have a South Georgia campus, North Georgia starts next Friday. So, all right, next slide. Okay, so ACOMAS is the link or site you go to apply. Just like any of these other sites, you have to create an account. If you've already applied, you have an existing account, log into that. Make sure that you get all the pertinent documents you need. So you use that to get your transcripts in, to get your MCAT scores in, everything, your letters of recommendation, your profile, your personal statement, the actual application. One thing I can't stress enough is once you submit into any system, AAMC or ACOMAS, you need to make sure, keep going back over and over and over and over again to make sure that it is there. Don't assume that once you've submitted it, everything is okay. Okay, your file might not be complete, and until the file is complete, the schools don't see it. So you make sure your file is complete. So you revisit. If anything is missing, you may have asked someone to write you a letter of recommendation, follow up on it to make sure that it has been received. Because until your file is complete, schools cannot, and I repeat, cannot review the application. Next slide, please. All right, so make sure you have all your prerequisites. I'm not sure about and Dr. Graham, you might, you can tell me as it relates to Emory, because he has one leg here and one leg there, guys. Person to talk to. He can, one leg here and one leg there. For DO schools, you must have 3 hours of a semester of biochemistry, and I'm not sure if that's the same for the AAMC. That's what I was, yeah, okay.
It's pretty consistent.
So basically the same prerequisites.
Same prerequisites.
We all want the same thing, right? The MCAT, your prerequisites. And sometimes we kind of like to look beyond your prerequisites a little bit, a class here, a class there, more advanced courses. So these are the prerequisites, whether you have your foot here, a foot there, whether you're looking at DO or MD. And we know a lot of students who apply to both because they just want to be physicians. They're not picky. They just want to work and be of service to others. So they don't really care where they go. Next slide, please. Okay, so what are we looking for? We look for the holistic, the entire person. So we don't focus on just your MCAT or your GPA. We want the whole person. What have you done? What makes you unique? Okay, so your letters of recommendation, your autobiography, basically your statement, your clinical experience, if you had research experience, if you had life experience, right? Similar to all the other schools, you may have done something very unique or decide to go, take a trip and go climb Mount Everest or something, to show your ability to endure or your perseverance. That is very unique to me as an interviewer and as a chair of admissions. So we want to know you as the person. What else have you done outside the classroom to make yourself stand out? Next slide.
I just want to say, Dr. A, just to add, you can advance, but I was just going to say that a great thing about osteopathic medicine is that in terms of non-traditional students, allopathic schools are catching up. Like I know at Emory, it's starting to become a less of a deal to be non-traditional. But again, like 90% of our students are traditional. But in osteopathic medicine, you'll find easily at a medical school people that are in their 40s, who went back to medical school, or, early 30s is not uncommon. Probably, like, if I'd have to say, I don't know numbers directly offhand, but probably 20% of a student population may be non-traditional students. So again, just kind of piggybacking on Dr. A saying this whole holistic review of credentials.
Yes. So there was a student a few years ago, and she I know I interviewed a student who, when she came, when she was admitted, she was in her 40s. We've had someone in their 50s, and it's okay. There's a student in the second year class right now who was a lawyer, and his story would just blow your mind. I actually interviewed him, his reason for wanting to be a physician. So the non-traditional student, not by age, but also by career, who've decided that I've always wanted to be a physician. Things didn't go well, life happened, this happened, financially I wasn't able to, so I went this route, but now I'm able to come and I still want to follow that dream. They do come back and we do accept them. So don't don't look at the masses and decide for yourself that you're not worthy. Go for it.
Yes.
Go for it. Okay, so in terms of competitive admissions, we have qualitative measures, we have quantitative measures, and we look at both of them, right? We don't look at one or the other. So we're not just focused on your MCAT, your test scores, your credits, direct patient cares, but we want your letters of recommendations, and you want a strong letter of recommendation. I don't even tell students to ask for a good one. I want a strong one. Right? A few weeks ago, they said, and I can't can't remember the school, but the person, the admissions representative, let me say that, shared a letter of recommendation that someone had written for a student. And it was kind of scary, you know. So you want someone who can vouch for you and talk about not just your grades, but your character. You want someone to speak as if they know you really well. So your personal statement, whatever it takes to tell your story as to why you want to be a physician, that shows your passion, your willingness to endure and persevere and get through it. You want that. Healthcare experiences right now, unfortunately with COVID, you know, that has dwindled down to nothing. But whatever you can do to get to that point, have that included. Next slide, please. And we won't be long, I promise. Okay, so basically the requirement is like anyone else. You have to have a bachelor's, your prerequisite. At PCOM, you have to be either a permanent resident with a green card, basically, or a citizen. We international students, like other schools, because of financial need and ability to pay for tuition, it's really not encouraged. Okay, so your letters of recommendation, as I said, a personal statement, your MCAT, your transcript, and an initial and institutional fee of $75, and then an interview. So, and the right panel shows you the profile for this current class of 2024. This is their profile. Unfortunately, in terms of the applications, the number of students interviewed and, you know, admitted and all that, they're still crunching the numbers. So I didn't get that, but this is what the class profile is as we speak. Our enrollment number is 135 here in North Georgia, or Suwannee. 55 to 59, we typically cap at 59 in South Georgia, and 270 in Philadelphia. And these are the MCAT and the GPAs, the average GPAs and the science GPA. Next slide. So I threw this slide in here just to see the trend for the, you know, for 3 years, right? And the numbers are no different than, you know, than what it is currently. Next slide. Okay, so what is the DO program all about? Just like allopathic, it is still 4 years. And as Dr. Graham said, there's just that one class that makes DOs different from MDs, and that is the OMM, right? So in the 4 years, you do 2 years of your basic sciences, developing skills, diagnostic skills, communications, and then the last 2 years will be your clerkship or rotations. Where here in Georgia and even Philadelphia and definitely South Georgia, they're actually out. And since PCOM currently does not, at least Georgia does not have a hospital, they're placed in different places. As the director of IPE, that's an additional class that's part of for the entire 4 years. I have to track students all over the world, as I call them. So I have students in Florida, students in Georgia, students in Delaware, students in Pennsylvania, and it's one student currently, 2 students in Alabama that I have to track. So these are the number of seats that we have: 270 in Philadelphia, 135 in Georgia or North Georgia, and 59 actually in South Georgia. Next slide. Okay, so what is our curriculum like? It's disregard all these abbreviations or acronyms. The first year is the core foundation. So we have gross anatomy, as we call it, SPOM, which is principles of osteopathic medicine, right? And then we have the CMBM is really cell and molecular biology, biochemistry. You know, it's a combined course as such, okay? And then we have clinical, basic and clinical neuroscience. That is the first year. And of course, we have primary care skills, PCS. This is where they are taught how to the diagnostic skills from the get-go. So we don't wait till they get into their second year, they start now. So in the first year, they do that. And of course, the manipulative medicine is also started in the first year, which is the OMM. So the second year is where they actually go into the systems. So cardiovascular, renal, pulmonary, that's CPR. RGU is really reproductive, endocrine, musculoskeletal skills. You have GI. Life stages is a course which I think is fascinating. It actually takes them through life stages. So you started in, with pediatrics and go into geriatrics, right? That's the course. And this one is ENT, emergency. I can't remember what the EN, never mind. But these are the courses. So they typically go into the system and learn everything. And by the time they get to the clerkship, they would have to start taking their step one. Now, this one would not be the USMLE. For DO schools, it's called a COMLEX. So they do the COMLEX 1 while they're in their third year in clerkship, and then they have to do their COMLEX 2 in order to graduate. Now, the COMLEX 2 has to be done during the third, fourth year, so to speak. And without passing the COMLEX 2, they cannot graduate. Okay? Another thing I want to point out is there's a few schools, 2 to 3 students or so, who want to be OMM fellows. And so they spend an additional year. So they're on a 5-year track as opposed to a 4-year track. And these are students who have really enjoyed OMM and want to incorporate it into their practice. And once they're accepted, they usually get financial aid. They get a scholarship to be fellows. Next slide. Okay, Dr. Graham, it's all yours.
All right. So, Dr. Jones, are we good on time?
Yes.
Okay. So I want to talk a little bit about osteopathic manipulation, because I know that people don't sometimes really know, like, well, what is it? What does it really do? So what's really cool about it is that it's all based on anatomy. By looking at certain fascia planes and musculoskeletal connections that we know exist, these techniques have kind of come about as ways to relieve disease. So, for instance, there is a technique that you can use to release the carpal tunnel, which, as we got a lot of you guys, I'm sure, know that sometimes carpal tunnel gets to a point where, of course, you need surgery, and that's the only way to relieve it. But there are some manipulative mechanisms that help open up the tunnel so that the nerve is not as impinged. There are techniques that even help with lymphatic drainage that can help people with asthma, with sinus disorders. There's ways to actually drain the sinuses. So the techniques are really designed to help with common kind of medical conditions, and they can be used in conjunction with medicine and surgery. So they don't necessarily have to be one instead of the other. They can actually all be done together. So it's actually like, I describe it as having like another tool in your toolkit, right? So you have those same drugs that your MD counterparts, that you've memorized and that what categories do what and the evidence for why you use these particular drugs. You have that in your brain and you know that. And then you also have this osteopathic manipulation that you also can use at your, so to speak, at your disposal. So just so that there's a lot of people, I think there's kind of like two camps of DOs. There's DOs who love manipulation and want to do it every day in their practice. And then there's some of us who, as Dr. A described, I think I'm in this camp, where I would absolutely go to one of my colleagues and let them do manipulation on me, especially if they're really good at it, because I've seen it work well for people, for myself included. It's just not necessarily my strongest suit. So because it's not my strongest suit, I don't really I use it for family occasionally, but I don't really use it in the patient care. I have like once or twice, but like not often in the patient care setting. And that's okay. There's some DOs who are just like me and they don't really. And then there's some that they do it every day. So I have a colleague, he's a family medicine doc, and I mean, he's using it probably 2 to 3 times a day on patient care. So it's really totally up to you how you want to use it. But it is a tool, and it's a great tool, and there's evidence to even support, that this tool works as well.
So if I may, I'm one of those. So someone rear-ended me years ago, and with insurance involved, they sent me off to a chiropractor, and trust me, it was a waste of my time, made things even worse. And of course, the meds were not working. And so I went to visit one of our faculty, and this was almost 10 years ago, and the adjustment he made was all I needed. So drugs went down the toilet, and that was it, so it really does work. And I've actually also interviewed a student who was in a similar situation where he was in a car wreck and nothing would help. His mother is an MD. And so with all the treatment, chiropractor, his mom actually suggested he go see a DO, right? And he went, and it worked. So I got to interview this student who said he wanted to be a DO because of the pain relief he got from his OMM treatment or OMT treatment. So it does work. So like Dr. Graham said, there are people who love it. I know several of our fellows just really, really like it and want to use it. And some people just want it as a tool, or just, don't want to use it at all.
I too was a patient. I was having dizziness one time and nobody could figure it out. I went to ENT and had this $1 million workup. Nobody could figure it out. And I went to one of our faculty members at PCOM, and he asked me immediately. He saw me and asked me immediately, am I having trouble chewing?
Mm-hmm.
And it turns out that I had a cavity that I didn't even know I had a cavity, and that was causing my dizziness. And he did some manipulations on me, cured my dizziness within a day. And I've had a few other things that I've had faculty members work on too, and it really works.
It really works. It really
does.
Yeah. We just got to start publishing more of it, so that way people will believe, especially in the allopathic world where it's all about evidence-based. And I'm for evidence-based medicine, don't get me wrong. And I think a lot of DOs are. It's just difficult to get funding, right, to do a double-blinded osteopathic manipulation study, right? Who's going to pay for it?
Right.
So anyway, yes. But it does work, guys. It's a real thing. And it's based on anatomy. It's not like hocus pocus at all. Like, it's all based on facts. Okay, sorry. So, because we don't want to go too long. Dual degree programs. We have a DO MBA program. We have a DO MPH with Thomas Jefferson University. So even I believe if you're in Georgia, Dr. A, correct me if I'm wrong, but I think you can take advantage of this if you're a Georgia student as well.
Yes, online. Do it online.
I guess now it's probably online anyway with COVID, but prior, I guess you would move to Philly.
Before it was still online.
It was still, okay, so you could do the MPH online. Okay. And then there's, of course, the certificates of advanced graduate studies. So those are just some other programs that we do have in conjunction with the DO program. Next slide, please. So applying for residency, as Dr. A has said, I'm actually very happy about the match becoming one match. There's some pros and cons, I know, for some people, DO students and MD students, I guess, that may feel a certain way about us becoming one. But I think what it does, also with getting rid of, since MDs are moving to basically step one is going to be pass fail. To me, it's like all perfect timing for all of this. So I think this is just going to widen the pool of applicants who can apply. So now you can basically apply for any residency. Same for MD. So MD students can now apply to DO residencies as well. So I know that probably in the competitive specialties, the numbers are going to go through the roof, like DO dermatology, DO, like those, I'm sure, orthopedic surgery, lots of MD applicants are going to apply to those, which I don't blame them, they should. And lots of our applicants are going to apply to programs as well. So it's going to be interesting, I guess, because this is the first year that we're officially one accrediting body. So ACGME is everybody's accreditation in terms of MD and DO. I guess to me, what I'm excited about is that I hope, even at Emory where I work, there is still, unfortunately, in certain residencies, some stigma attached to DOs coming into certain residencies. And so, emergency medicine has been one that, like at Emory, that people they've taken the deal like almost one a year. Internal medicine, we still got some ways to go. I got to talk to my brother, Dr. Jones here. His wife has the reins of the program. See what can we do about that. We have, I don't know if you know this, Dr. Jones, but there is a PCOM Georgia graduate intern in the Emory primary care track program. And so she's been the first one in about 3 years to match.
Excellent.
And she was, I think, #1 in this previous Georgia PCOM class. So I'm happy that they did take her, but we need to get more in that residency. It's a big residency. But anyway, I digress. But to say there's really no residency that you cannot go for. The ARIS application system is the same. Deals apply in the same system. I mean, it's really, with this whole move of ACGME being one accrediting body, I think it's just going to be a win for everybody, to be honest, in my opinion. I think also it's going to take away some of this deal stigma too, because there are still some people who feel like, well, are the deal students as strong as our MD applicants? And the answer is yes. They're the same. The training is the same. The knowledge is the same. The tests are different. Complex is different from USMLE, but it still tests the same. I took both tests. And it tests the same. USMLE's questions, I feel like the way in which they ask questions is a little bit more challenging because they ask like second and third tier thinking questions, but the knowledge that it takes to answer both, you got to have it, both to do it. So it's really not that different. So in terms of residency, next slide, please. So these are just some quick initiatives that we're doing for underrepresented minority students. So I want to make an announcement that's not on here, but we are currently in negotiations with, is it 5 HBCUs, Doctor?
HBCUs and HSIs.
And HSIs, which Hispanic Serving Institutions, to actually come up with an agreement that we would put special focus on their students that are interested in coming to PCOM in particular and osteopathic medicine. So as a way to kind of have a diverse pipeline of students coming into our schools. Currently, I would say that our biggest diversity pipeline has been the biomed program, which is basically a post-bac program. PCOM has a 1-year or 2-year option program that you can do. And we typically take students out of that. I know Dr. A and I discussed that if you have a GPA of a certain, your post-bac GPA is a certain level, you will all be at least granted an interview, not necessarily guaranteed admissions. We don't have that, unfortunately, but you would at least get an interview. And I can say I've seen anyway, and Dr. A is on the committee, so she can speak even more to this than I, but that lots of students are coming through, especially students of color. Black students in particular have come from biomed and then gotten into the DO program. So that is a route that you can go. But these other programs listed are just, we have a program that they do minority outreach, Minority Opportunities and Research More program in the Suwanee area. These are more high school, I think, oriented programs, but we do have programs where we're specifically look. Philadelphia has their own. They have mothers. What is it, Dr. A? I forget for the MOBS.
Yeah, Mothers of Black Sons.
Yeah, Mothers of Black Sons in Philly. So this is like an educational initiative to help connect. I guess it's primarily single moms who are raising sons and getting them involved in education. And educational opportunities. So that's something out of Philly. We don't have that in Georgia, but Dr. A is working real hard to try to get one in Georgia set up soon. So these are just a sampling of those programs.
There's a question in the chat that asks, are you all at liberty to discuss those 5 HBCUs yet and HSIs or not yet?
No, until
until the ink is dry.
until the conversation is complete. We don't.
Okay.
Yeah.
Okay. And when do you anticipate that would be for next year, next cycle, I guess?
Hopefully. I mean,
okay.
That's what I was informed today.
Okay.
That's what I was informed today. So hopefully the next cycle.
Okay.
I was told that they were in the final conversation for this affiliate contract.
Can I add? We'll speak offline about that. But I would like to help get involved in that if possible. So we'll talk offline.
Of course.
So next slide is the all important one that I'm sure everybody wants to know is how much does it cost, right? So if you get in, then how much are you going to have to pay? So the Doctor of Osteopathic Medicine program is $52,722 per year. So it's pretty expensive. I can say
Good down
that.
payment on a house.
Huh?
It's a good down payment on a house.
It's a good down payment on a house. It is. And the biomed, which is the post-bac program, is $957 per credit hour. Is about what the tuition fees are. Next slide, please. So we have the kind of typical, need-based scholarships, need-based grants. There's a few merit, Dr. A, not many merit scholarships though, right?
No.
Yeah, that's what I said. I know they do.
Merit-based, there's a one full scholarship, half a scholarship, and a Hispanic scholarship.
Okay. Of course, work study, public and private loans. A lot of students, that's probably the majority of it is public and private loans. And then, of course, if you're interested in any of those like national health services or military, a lot of people do the military. And I know I have 4 or 5 classmates who use the military as a way to pay for their school. If that's something you are willing to do as a way to get your tuition paid. Osteopathic students are also in the military serving, and they do military. One of my friends actually did neurosurgery at Walter Reed. He's a DO. So yeah. All right. We're almost done, Dr. Jones.
Okay.
This is our simulation center.
A few good questions coming up, so okay, anxious to get to those, but go ahead.
Okay, no, we'll move this quick. This is just, we're big on simulation at PCOM. We have a state-of-the-art simulation center. So you can pretty much do anything. You can have a baby, codes, everything in the simulation. It's pretty amazing, our simulation center. So it's pretty state-of-the-art. Next.
State-of-the-art.
It is.
This is a picture of the anatomy lab. Oh, I remember these days. Lots of days and nights there. So yeah, we have a state-of-the-art anatomy lab, of course, as you can see, with flat screens everywhere. So if you can see the different dissection areas and all the tables, I'm sure standard like any nice anatomy lab at other medical schools, but it's a nice, they try to do the best that they can in terms of ventilating and other things of the lab. But yeah, next slide, please. So again, this big events that Student Affairs kind of helps, of course, is orientation, white coat ceremony, academic support and counseling services. We have a very active Office of Diversity and a Diversity Council, an LGBTQI council as well, community and minority outreach, as well as diversity and cultural sensitivity workshops. Next slide, please. Should be close to the end. We have over 50 student organizations. So for my African-American and Latinx students, we do have SNMA. We also, I think, have LMSA as well, Dr. A, right? LMSA chapter as well.
And
so
also the SNMA version of the pharmacy version of SNMA.
Yes.
They always try to work.
I forgot about the pharmacy school. Yes, we have our student national pharmacy as well, which is basically underrepresented minority pharmacists. Mm-hmm. Yeah, and then there's our multiple fellowship and training options. So our Philadelphia campus has majority of our residencies. So Philadelphia has pretty much everything. I know they have a neurosurgery residency. They have urology. Between New Jersey and Philadelphia, most of those residencies and fellowship. We do have some here in Georgia. Family medicine we have here in Georgia. I think we have internal medicine as well at Gwinnett Medical Center. So we're starting now here. They're starting a general surgery residency at Gwinnett, or either it started this year. I think this is the first year of general surgery at Gwinnett. So we're getting there in terms of residency training and fellowship training. Next slide so we can get to the questions. So these are just, again, Dr. A mentioned these already, so I won't go over those anymore, but these are all of our the biomed program and contacts for every person in pharmacy, PA, and PT programs. Next slide, please. These are the contacts for each campus. So if you're interested in the South Georgia campus or the Georgia campus, correct me, Dr. A, I think from the ACOMAS side of things, you go still through PCOM, and then you can apply specifically to which campus you are interested in. Is that right?
You apply to each individual campus.
Right. Okay. Next slide, which I think we should be at the end. Next slide. Yes, thank you.
Thank you.
All done. And so now the questions in the chat, I'm happy Dr. A and I both can answer.
Well, thank you very much. Excellent presentation. Let's, Rachel St. Bernard, you had two good questions on there. Are you still there, Rachel?
Yeah, if not, I can just
Yes,
answer.
I'm here. Let me try to get somewhere quiet.
Let's see your face, Rachel.
COVID. Well, I'm trying to get somewhere quiet and bright.
It's fine.
life in the times of COVID.
Been
Where are you
there,
calling
But-
from?
Well, I'm in Michigan, but I'm a New Yorker. I say that every time someone asks me where I'm from. I'm from New York.
Okay.
but I'm in Michigan, and I wanted to ask, because with the application cycle, I've been thinking for a while about applying DO, but I don't have any DO shadowing experience. I've volunteered in hospitals where there have been DOs and MDs, but I don't have any direct experience. And a lot of DO students and, pre-med students say you need to have that for your application, or you don't have such of a strong application. So I'm wondering, do I need to have that if I'm to apply DO? And by this point in the cycle, how late would an application be considered? Is it too late to apply?
No to both questions, right? And especially with COVID, we're getting away with so much in COVID.
Yeah, COVID, this is the time.
So now just blame it on COVID.
Yeah.
Just like coronavirus, you didn't get it. Just no, don't tell them I said that, but blame it on COVID. But it's not necessary. As long as you have shadowing experience, that's what we're looking for. DO experience would be great, but it's not required. Not at least not at PCOM.
There are some DO schools though, if you want advice outside of PCOM, that do require
Right.
admin. But PCOM, no, it's not
No,
a
not
it's
here.
nice to have, but you don't have to.
Yeah. But even if it's the other schools, just once again in your personal statement, blame it on COVID.
Yeah, there you go.
Think about it, because people plan and it didn't, or planned and it didn't happen.
Yes.
Right. So just blame it on COVID. Go ahead.
No, I was thinking, because I did speak to a student who's in DO school now, and she's like, there's a school nearby, maybe a hospital nearby where you can maybe do it. And I'm like, well, I also have a family. So with the cases upticking, I don't want to go into a hospital. Blame.
Yeah. And in terms of the cycle, you're not late. Just get it in as soon as possible, but it's not late.
And should I just reach out to the other schools and find out? Because of course I'm going to apply to others to increase my chances.
Yeah.
Okay.
Yeah.
If you go on their sites, almost every site that requires, and I was trying to remember what schools were specific. I don't know if you're interested in Michigan State since you're there in Michigan, but the Michigan State Osteopathic School is very good. They actually take their first 2 years, the MD students there sit side by side. So they literally have the same curriculum, except they are in class longer because they go to OMT at the Michigan State Osteopathic School. So I believe that they strongly suggest, but again, as Dr. A said, if you write it very well that I have a family, I'm a non-traditional student, I could not go out and meet a DO and shadow, but I do have some experience in the healthcare. Clearly you have on Scrubs, you likely have some healthcare experience. You can talk about that very strongly and position it that way. And I don't think, again, as Dr. A is saying, in this particular time, this is an unprecedented time. And I think everybody knows you're going to have to be a little bit more lenient with certain things. And that's like, if you're a good applicant with good grades and a great story, why should you be denied because you haven't had a chance to work with a DO, but you're interested in DO school, and at least you understand what being a DO means.
Thank you, Rachel.
Thank you.
We have one more question we'll take. We're getting late in the hour. Michaela Williams.
The question I had was, does PCOM Georgia have on-campus housing for students? And if so, where do students usually live?
Oh, go ahead, Dr.
And where are you calling from, Michaela?
Tampa, Florida.
Tampa, okay.
Hey, that's where I'm from.
Okay.
Where are you, Michaela? We can't see you. Where are you?
I'm sorry.
But go ahead, Dr. Graham or Dr.
Okay.
A.
Yeah, unfortunately, we don't have on-campus housing. but there are so many apartments nearby. I mean, as long as, I mean, students live, so the college is in Suwanee, but Lawrenceville is literally across the street, or the
Yeah.
city. When I say literally, you cross the street and Lawrenceville is there. So a lot of students live either in Suwanee or in Lawrenceville, or they maybe live, 10 minutes away in Duluth, right? So Suwanee is surrounded by all these cities. And so it makes for easy housing or, commute to school.
And
There's,
reasonable price too, because it's a
yeah, very,
suburb.
very reasonable.
Swanee is in essence a far suburb of Atlanta, but nonetheless, housing is much cheaper out there, especially apartment housing. And
Beautiful housing.
last
Beautiful
minute.
housing.
I mean, I had a guy and Dr. A knows him, that came out the waiting list a week before class started, and he moved from Philadelphia to Georgia in 1 week and had an apartment and started medical school. So.
Well, let me throw out just one question I really want you to hit on, again, Dr. Graham, just to make sure that people understand how you're on faculty at Emory, and you have a very big role at Emory on the admissions committee at Emory, and you're a DO. And so how DOs and MDs work side by side, you mentioned that earlier, but I just want you to hit on that again very briefly, and that in today's world, it really doesn't matter.
Yeah. So again, I did train at all MD. So all of my training beyond medical school has been MD programs. I do think that's been helpful for me, to be honest. And I went to Hopkins, and that always helps. So people don't really question me, to be honest. I've not had I think also because I went to Hopkins, at Emory, people assume that I'm an MD until they see I always make sure my credentials are written correctly, at least if I'm in control of what my name is going to be put on something. And so then they'll be like, oh, I didn't know that you're a DOs. And that's it. And that'll be the conversation, or like, oh, I didn't know. But they don't necessarily say like, oh, or make me feel like they think less or whatever. So to Dr. Jones's point, because majority of DOs actually are training in MD allopathic programs. There's not enough DO residencies. So most of us are being trained by MD, residency programs and fellowships. And so with that being said, what can people say? If you train side by side with them and they've seen the same patients you're seeing, they know that in terms of the quality of your education and your ability to take care of people is the exact same. So I think the barriers are coming down. I don't want to lie to the students though and tell them that there are not still some barriers, because there are. Let's just be honest, there are. But I think, again, when I think about from when I finished DO school to now, it's a huge difference, and those barriers are coming down quickly. And as I was even saying, even at Emory, I want us to be a little bit more open at Emory. And again, I want us to take top students, just like they take top MD students. Just take top DO students. And that's kind of what I've been saying to, different people that I have some level of influence with. When we consider applicants, just consider the best ones that we have, because the best ones we have are just as good. And so, again, around the country, I do believe, especially you go to the Northeast, the DO discrimination is a lot less, because they've been so planted in the Northeast, like Philly and above, or DC, Maryland and above. There's so many DOs there because the schools are much older there. It's less DO discrimination. It's the South. We just got to kind of catch up a little bit, because DO schools are starting to really kind of come into the forefront here in the South.
And I know when I was faculty at Morehouse, we had two of the best surgery residents that I had come through there were DOs.
Yeah.
And this past year in their family medicine department, the intern of the year was a PCOM graduate.
Yes, she's
phenomenal.
Is it actually Roxanne?
Yes.
Yeah, she's amazing.
And so she's opening doors for everybody else. So I've just been very impressed, and I've been very fortunate to work at PCOM. And to me, there's no difference. There's no difference.